Hey everyone, Allison here with Dental Reflections Dublin. Wanted to talk about our part one in our series, 5 Ways to Save. So this week we are going to talk about nutrition. So the whole point of our series of the 5 Ways to Save is that a lot of times patients are asking us, why am I always getting cavities? I feel like I'm doing everything I should be doing at home and I'm still getting cavities. They're getting discouraged. People say, dental treatment is super expensive. It's maybe out of their budget for certain treatment procedures that are diagnosed. So we want to give you some tips, things that you can start implementing today of really how to save money on dental treatment. So part one in our series again is nutrition is our topic. So I'm gonna go ahead and make sure my volume is up and good. Okay, so first, what I want to talk about is just healthy foods and healthy snacks that you can eat. So things that are going to be healthier for the mouth are things like nuts and cheeses, yogurts, dairy. So yogurts, milk without added sugar. So not talking chocolate milk, talking about white milk, yogurts without the added sugars and are going to be very beneficial to the mouth for the bacteria in your mouth. pH plays a really big role in getting cavities, your chance of getting a cavity. So some people just have naturally more acidic pH, resting pH. So they may be giving the mouth, proper environments, and after the saliva buffers, it still may be a little more acidic. So there's different ways that you can help try to fight that and help try to get the acidity back to neutral. Now, we have been taking the pH of everyone's mouth when they come to their visits, and we use these little pH strips here. You can actually order them from Amazon. They have a ton of different kinds that you can get. And it's just a little strip that goes in the mouth. Get it wet with the patient's saliva. It's a little indicator strip here. And this gives us a really good idea of what your resting pH is. So the best time to check it is going to be 2 hours after you've ate anything or had anything to drink to give us the best indicator. We wait 15 seconds, have the patient put it in their mouth, and then we have a little chart here where we read it. And the greens, more of like the green here, is going to be neutral, which is going to tell us that you have a low risk of getting a cavity. So if it's more acidic, that's when we're going to talk about diet and nutrition and ways to really help, get the pH back to neutral. So, also, let's talk about drinks a little bit. So it's more based on also when it comes to beverages that you're consuming, it's more based on frequency versus the amount that you're actually consuming. So when we talk about frequency, say that you are drinking a cup of coffee, you're drinking an 8-ounce cup of coffee over a 1 to 2 hour period of time. Each time that you take a sip of that coffee, it's going to take about 20 minutes to buffer the pH in your mouth and get it back to neutral. So that's pretty significant, the 20 minutes. So say you take a sip of coffee every 5 or 10 minutes for an hour. That's going to really take a long time for your pH to buffer back to neutral. So it's better to drink it in a shorter time frame. So say you drink the 8-ounce cup of coffee in 15 minutes, then it's going to be a better environment for the mouth. People don't realize that a lot of bottled waters out on the market actually are acidic. So filtered water is a better option. So if you're curious about your drinks and the water and everything, I encourage you can order the strips, the pH strips, online, and you can test your water at home. So like the Brita water filters, those are going to be a better option. They don't filter out everything, making the water more acidic. It's going to have a little bit more of the naturally occurring minerals and those types of things to help keep it at more of the neutral level. And also, same goes with tea, with honey. You're adding in that sugar, so it's going to be sweeter. It's going to be a higher acidity with that. Same goes with sports drinks. We see a lot of increase in cavities with teenagers in sports that are consuming those over a long practice time, long game period, because of the acidity of those. Very, very acidic with these sports drinks. Of course, soda, that's obviously a gimme. We all know that soda is very acidic. It's bad for the teeth. And that's going to be, if you really want to indulge in a soda, it's going to be better to have a soda with a meal, because then you have the foods to help buffer, and while you're eating, you're producing a lot of saliva, so that's going to help buffer out the acidity of the soda as you're drinking it. So if you want to drink the sodas and those types of things, it's better to drink those with meals. Now, also, if you are a frequent snacker, we hear a lot, people are trying to eat healthier. They're trying to eat more spread out to maintain their metabolism. They're eating 5 to 6 small meals a day versus 3 large meals with no snacking. So that is, of course, going to be better for the overall health of the body, but not as good for the mouth, unfortunately. So what we recommend for frequent snackers is just choosing sensible, healthy options. So things like the nuts, the dairy, the yogurts, cheese, that's going to be helpful. And also what you can do after your snack, we don't want you brushing 5 to 6 times a day, because that also is going to, you should wait 30 minutes after you consume something acidic, because the enamel may be broken down a bit from the acidity. You want to wait that 20 to 30 minutes to brush your teeth after consuming something acidic, because that way the enamel is getting a chance to buffer, re-strengthen before you're brushing. So a better option besides brushing after every meal is, or every snack, is to rinse with water. Swish around, really rinse your mouth with water to help cleanse the food and the remaining particles from your food or drinks to, flush those out of the grooves of the teeth. Also, you could do a mince or gum with xylitol. So xylitol is a natural sweetener that actually helps buffer the pH in your mouth. So if you look on the back of your gum, mints at the store, a few popular brands are Mentos gum. It's really good, very refreshing, actually holds its flavor for a long time. A lot of the natural gums, you may notice that they don't hold their flavor for very long. So I would recommend the Mentos gum. I would recommend Orbit gum also. And then there's Spry, S-P-R-Y. That one you're going to find more at the natural health food stores. So Whole Foods, those types of things. They have a lot of different variety of flavors in that. That's one that doesn't hold the flavor too long, but it's definitely an option. It's not like you have to chew it for a long time to help buffer that pH and get it back to neutral. Gum also helps remove those sticky particles from the teeth, so it's another added benefit. If you're not a big fan of gum, you could do mints. So a lot of the mints have the xylitol in them, which is also a really great option. Also, something else to keep in mind is a lot of red meats have B12. B12 actually helps promote healthy teeth and gums. So it's a great vitamin that is naturally occurring in your food that is going to be beneficial, as well as vitamin D. You need vitamin D for your teeth to absorb calcium. So that's going to be in more of your dairies. So vitamin D is going to be in milk, that type of thing. Now, also kind of switching gears back to snacking, when I said that nuts are a healthy option, you have to be careful because a lot of people go for trail mix. So trail mix a lot of times has dried fruit in it. Now, dried fruit is very sticky. So raisins, of course, it's a healthy snack, but it's not healthy for your teeth. Anything sticky, like dried fruit, raisins, gummy bears, of course, that's not too healthy of a snack, but any of those types of things are not going to be good for the teeth because they're very sticky. They stick into the grooves of the teeth, and that's going to be the perfect environment, that acidic environment, to form a cavity. So we want to try to avoid those sticky foods. And if you do have those, maybe follow up with the gum, with the xylitol after, to help try to get as much of that out as possible. It's going to be beneficial. So, you know, some people, it's harder for them to keep the pH balanced. They may have that more acidic pH, but if you're choosing healthy snacks, healthy drinks, water is going to be the best between meals. Water is so good for the mouth, just keeping the mouth clean and cleansing the mouth between meals and snacking. And definitely you want to drink a lot of water every day. I think that pretty much sums it up. If anyone has any questions, feel free to ask, or you can comment. We'll have the video up on our page to ask any questions that you may have about nutrition, diet, and those types of things, that we can help give you as many pointers and tips as we can. So thanks for tuning in, and we have our schedule up on our page for our next series, part 2 in our series. It's a surprise what the topic is, so we hope that you'll join us, and we look forward to it. Have a good day. Thanks.